Welcome back to HRS. Childhood is often seen as a time when people are more vulnerable to getting sick because children's immune systems are still developing. While there are a few childhood illnesses that are particularly common, there are also things that can be done to help prevent the little ones from becoming sick. This segment is sponsored by pediatric affiliates of Hampton Roads. Dr. Nancy Wick is a pediatrician there, and she joins us now to educate us all on the importance of vaccines. Dr. Wick, welcome to Hampton Roads Show.
Thanks.
What should parents be thinking about right now? There's lots of parents out there with little kids going to school and all that. What's at top of their list of what they should be concerned about?
Well, this time of year, everyone's going to get sick. Your children, unless they're really lucky, are going to get colds. They're going to get minor illnesses, and that's normal. So.
And so you're seeing a lot of families and kids coming in right now
with sniffles and coughs. There's certainly more serious stuff like COVID, RSV, all of the usual stuff.
All the usual stuff, but there are two childhood illnesses that pediatric affiliates see on the uptick this fall. Talk about those and how you can vaccinate yourself against them. So
this fall, there is a new vaccine for an illness called RSV. RSV is a respiratory illness. It's really serious for young babies, especially under the age of 1 year. It is one of the more common reasons they get hospitalized. Makes them pretty sick. We have never had a vaccine for it until this year. So we're very excited that this vaccine is out. It just got FDA approved like last week. And so you should really be asking your child's doctor about it. Because it should be coming in pretty soon.
How often do you see a baby like that with RSV, and what should the parents be looking for?
It's very, very common in the fall and winter. Little babies will be coughing a lot. They will have trouble eating. They may have fevers. They'll be breathing fast. And so when they're really sick like that, sometimes they need to go in the hospital for oxygen, which is why this vaccine is really important.
And talk more about COVID-19 and children and how they're affected by it.
So COVID has not gone away. It can still make kids and adults pretty sick. They are still having fevers and coughing. And then there is a new COVID booster this year that we are recommending that everyone gets above the age of 6 months.
How often are parents bringing their kids in for vaccinations right now? And when they go to school, it's kind of spreading everywhere.
Right. So everyone should have a COVID vaccine, and the boosters are starting now. There's also the flu vaccine every year, and that should be something they should be getting now. And they should be asking about the RSV vaccine. And
we know that COVID's out there. And how much are you guys seeing it?
We've had a little bit of an uptick over the past 2 or 3 weeks. It's not like last winter where like it was really surging, but yes, there has been a bit of an increase.
And how are kids dealing with it? Is it more severe now, or is it less?
No, it's about the same.
Right.
Most young people who are healthy, they're fine. They get sick, but they don't have to go to the hospital. There is a few though that do, and then of course they spread it around to other vulnerable people. So.
Let's talk a little bit go back to RSV and children who get the vaccine. Is there any, do they feel any effects of it early on or not?
It just came out, but based on the studies, it doesn't really have any more side effects than other vaccines. It's the same kind of, it's actually works like a vaccine, even though it's a monoclonal antibody. So it doesn't really have any other side effects besides, what you see with typical vaccines.
And let's talk a little bit about pediatric affiliates of Hampton Roads. Tell me more about it and what people should know.
So we are a pediatric practice with 2 pediatricians. We're small, and we think that's an advantage because we get to know our patients very well, and it's easy to get in touch with us. We answer the phone. We have people on call every night. It's either myself or Dr. Lehman, the other doctor, and we talk directly to you. So it's very close-knit family kind of situation.
It's kind of what you want when it's your child involved. And real quickly, your advice to any parents out there with young kids?
Just don't hesitate to call your doctor. Watch for symptoms, and don't worry if your child gets sick because they're supposed to.
Right. All right, Dr. Wick, thank you so much for all this great information.
Okay, thanks.
And thank you for joining us here on HRS. This segment is sponsored by Pediatric Affiliates of Hampton Roads. They are located at 200 Grayson Road, Suite 101 in Virginia Beach. Schedule an appointment today. Give them a call, 757-473-3200, or visit their website, docforkids.com.